So today we're going to talk about chemotherapy-induced peripheral neuropathy. And as I said, my name is Shelia Manning, and thank you for having me. So today we're running a little behind. So we're going to review overview of the nervous system, the causes of CIPN or chemotherapy-induced peripheral neuropathy, and how we prevent that or try to prevent that, our expected course of recovery, the conventional treatment options, and then some complementary treatment options. And please forgive my phone ringing. So the nervous system is really broken down into two things. It's the central nervous system, which is your brain and your spinal cord, and then it's your peripheral nervous system, which is the nerves leading out from the spinal cord. So when your peripheral nervous system is kind of the everything else, and that consists of motor and sensory. So the somatic part of our sensory nervous system provides position, our touch, our pressure, our pain, and our temperature. So nerves are like, they're bundled up and they're wrapped in a fiber, just like electrical wire or kind of cabling coming into your house. So that is what we're dealing with. So what is chemotherapy-induced peripheral neuropathy? Well, it's nerve damage caused by therapies that we use for cancer treatment. It's very common and debilitating side effect of several cytotoxic agents. Most commonly, it's taxanes and the platinum-based compounds like oxaliplatin or cisplatin. And while it often resolves after discontinuation of chemotherapy, in severe cases, it may take up to years to dissipate, and sometimes the damage may be permanent. Because of this, oncologists often reduce the dose of chemotherapy, or they can switch drugs, but it definitely can affect the quality of life, like your fine motor skills, difficulty or inability to button your own shirt, put in earrings, difficulty with balance, and then constant or intermittent pain. And then although the prevalence decreases with time, one study showed that 30% of patients after 6 months still continue to suffer from chemotherapy-induced peripheral neuropathy. There are other causes of neuropathy: diabetic neuropathy, which is excessive sugar that damages nerves; disc disease, compression of your nerves in that spine when you compress those nerves leading out to the body; infections such as shingles, Epstein-Barr virus, herpes simplex virus, or Lyme; chemicals such as lead, mercury, insecticides, or solvents; and chronic alcoholism can also lead to neuropathy because of the depletions in the B vitamins. And then the causes of chemotherapy-induced peripheral neuropathy, there's a lot of causes, but basically it's really the cumulative dose and infusion duration that happens. And while two individuals may receive the same chemotherapy, they may have very different outcomes. Genetics plays a part in that. That is a new area of research. You can also receive neuropathy from radiation treatments when you get oxidative damage to nerves, and of course surgery if you cut a nerve. So we're going to kind of break this into prevention and then treatment. And while I make that distinction, prevention, I really never tell patients I can prevent peripheral neuropathy, but I can reduce the severity or attempt to reduce the severity. Not everyone gets peripheral neuropathy, but we don't have any products that we can say without a doubt prevent neuropathy. For prevention, there are certain products that we'll use that are completely and absolutely contraindicated in prevention, but not during treatment after after you complete your infusions. So it's important to recognize the symptoms early, reduce the chemotherapy. Some of the supplements that have shown promise are L-glutamine, DHA, or omega-3s, often found in fish oil, B vitamins, and vitamin E. The supplements to avoid that will later attach back onto treatment are acetyl-L-carnitine, glutathione, and ALA or alpha lipoic acid. And there's other promising interventions such as cooling your periphery, your hands and your feet, compressing your hands or your feet, and exercise. So L-glutamine is an amino acid, so it's the primary fuel that's used in your mucosal cells. And those are the cells that line your mouth, your throat, your stomach, all the way down. It's often used in other parts of cancer therapy, including if you have diarrhea, um, and that can be also from radiation to the pelvis. It's also used as a mouthwash or rinse for people that are receiving head and neck radiation therapy. So really, several studies have shown really good potential benefit of using this. We don't use it long term. There is some concern that cancer cells may use this as fuel, but not in the short term. So we generally dose this at 10 grams 3 times a day for 4 days, and that starts 24 hours after infusion. I find that a lot of people don't want to do things 3 times a day. I wouldn't want to do things 3 times a day. I can't even take my supplements once a day. So oftentimes we'll say just take 15 grams 2 times daily. And that comes in a powder form. You can mix it into a smoothie. Some people with feeding tubes can actually put it in their feeding tube as well once it's mixed with water. The next one is DHA or omega-3s, your fish oil capsules. And I'll just throw this in here now. Not all supplements are created equal. So it's really important to understand the quality of supplements that you're using and making sure that they are fully tested. There have been a lot of studies and reports that show supplements you order, once they test them, they even found like common house plants in some of the supplements instead of the active constituent that was supposed to be in there. So fish oil is one of those things. If you get a bad fish oil, you can get the fish burps, and no one wants that. So fish oil is really a great anti-inflammatory. Besides just overall anti-inflammatory support and making people feel better overall during infusion, it does benefit nerve health. So the studies here are small, but looking at protection against CIPN is around 700 milligrams. I dose 2 to 3 grams per day of EPA and DHA combined. And you do want to be aware that it is antiplatelet activity. So if you're on blood thinners or already have an issue with platelets, that's a contraindication for this. B vitamins are another one of those things that has shown to help. There is a little evidence to this. I think more as clinical. We've seen some clinical positive results with this. Now, the only problem with B vitamins, with B6, it does help with neuropathy. However, if you go over, it can actually induce neurotoxicity and cause neuropathy-like symptoms. So you have to go around 100 to 200 milligrams. Vitamin E has shown to possibly be helpful, but there's 5 randomized clinical studies that showed it reduced the incidence of neuropathy. Um, there was a larger randomized controlled trial that reduction was not observed. So, this is really not our first line intervention. One of those reasons is because antioxidants are often considered a contraindication with cancer therapy because you want oxidation to kill cancer cells. So, if you give too many antioxidants, the theory is, although not proven, that it would be a contraindication because you would be killing the oxidants that are killing the cancer cells. And then cold and compression is an interesting. It's newish. Um, it has been shown to reduce the severity of neuropathy. There are cooling caps that you can wear to prevent hair loss. There's also cooling gloves and socks that you can use to prevent neuropathy. And the mechanism of action here, it's proposed that if you get your fingertips and your toes cold, it shunts the blood away from that area. So the blood carrying the chemotherapy won't get to those peripheral nerves. So it's shown around negative 20 degrees Celsius to 30 is really where the sweet spot is. But it is, I have seen a lot of people stop this because it is uncomfortable, as you can imagine. There has been a couple of studies showing compression may be helpful, and really that's just using two surgical gloves on your hands, just doubling up with that and doing one size smaller. So it's squeezing your fingertips and shunting the blood away from there, therefore decreasing the temperature of your hands. And then finally, there was a great study showing comparing actually cold to exercise, and there was a 12-week at-home exercise regimen, and that showed uh, really great promise. So there was a 12-week home exercise. It was progressive strengthening, stretching, and balance. So there was an exercise 5 times weekly for 12 weeks, and it started with 10 repetitions for the first 3 weeks, increased to 20, and then it went to 30 repetitions. And they used common household things like 2 half-liter water bottles to exercise. This is just one example of the exercise. But they found that the cold only group had an increase in hand numbness, increase in weakness, and in distress because it was too cold. The exercise reduced the neuropathy symptoms of numbness in hands and feet significantly. So that was just a little bit about how we kind of try to prevent or decrease the severity of neuropathy. And then this is kind of neuropathy recovery. So how are we going to recover? Well, your distal nerves regenerate at about 1 millimeter a day. So all of this depends on healthy blood vessels. However, this process is slowed by diabetes and possibly after chemotherapy as well. Sometimes I hear patients say to me, I eat healthy, I make healthy lifestyle choices, but yet I still have cancer. So I'm not sure why I did all of that. The healthier you go into something, the better the outcome will be. So, and it's never too late to start making those healthy lifestyle changes. So, some of the conventional treatments are antidepressants, neuromodulators. I'm sure some of you have heard of these, like gabapentin. You can do lidocaine patches, you can do opioids or tramadol, and you can also do cannabinoids, which suppress inflammatory and neuropathic pain. There's a lot of studies that are going into that now. Some cannabis type products are being developed um, as a prescription. Others are used probably not legally. Well, I know not legally in Indiana, but in Michigan, there has been some use with those. And physical therapy. So, physical therapy, we've really, there is light therapy. There's really no quality human studies, although it does seem to at least people say it helps them. And then there's low level laser therapy, and that works by stem cell activation, which I'll go into the next slide. And then muscle strengthening. We just like to encourage muscle strengthening to reduce your risk of falls. So low level laser therapy, or LLLT, is infrared and near infrared wavelengths. And some of you may have heard, like, local tanning beds have red light therapy, and people are using that for anti-aging. It's actually been shown to be somewhat effective in helping neuropathy. There are, as you can see on the screen, there are red light boots you can purchase. There are laser devices like the one shown on that foot. And there's also, you can just go to the bed, to a infrared bed at a tanning salon. But the study was 12 weeks of daily sessions for 3 hours on the specific neuropathy spot. But I think this could be useful when combined with other modalities like supplements. Acupuncture has been shown to alleviate pain and to lessen severity. It works with numerous pathways. The proposed mechanism of action is stimulating nerve endings to increase the circulation. So, where we were trying to shunt circulation away from the hands and feet during infusion, now we're trying after, when we're trying to repair, we're trying to get blood flow back to the area. And then studies show benefits with Velcade and after taxanes, but not during. So we'll wait until after therapy for these. And then, of course, diabetic neuropathy. There are topical treatments you can use. There's either menthol cream or capsaicin, which is just pepper. So there is a patch you can get for the capsaicin, and the menthol cream seems to be a little more gentle. You have to be really careful with the capsaicin cream. You don't want to rub that on and then rub it on your eyes. Trade one thing in for another. And then topical treatments, and anyone can make these. Anyone can pick up essential oils. The blends that have been shown to be really helpful are clove, rosemary, holy basil, and peppermint. You just add 5 drops to hypericum oil, or you could do an olive oil or a almond oil, and then you massage it twice daily into the affected area. AcetylLCarnitine is one of those that are contraindicated during chemotherapy, but have shown a lot of benefit afterwards. So it is involved in energy production, heart and muscle function. There is small studies suggesting a benefit in diabetic neuropathy. It is also great for cognitive decline or almost that chemo brain fog. And the dosage is 1 to 3 grams daily. And then alpha lipoic acid is ALA. It's an antioxidant. So it's another one of those reasons why we don't want to use it with chemotherapy. But it is not only is it helpful in neuropathy, but it's also helpful with lowering blood sugar levels, improving nerve function, and relieving uncomfortable symptoms in the legs and arms. So it's really overall muscle support. And we're going to dose that at 300 milligrams twice a day or 600 milligrams once daily. And then B vitamins obviously are very essential for nerve function. There are medications that cause deficiency. So long-term use of NSAIDs can cause deficiencies. Oral contraceptives can cause deficiencies, corticosteroids. And of course, we said earlier, alcohol impairs conversion of your B vitamins. So high doses of B6 also inversely can interfere with medications, such as L-DOPA and some anticonvulsant or Parkinson's medications. So I always encourage people to try to choose healthy food choices, nourish their bodies. You can get some B vitamins from salmon, potatoes, avocado, spinach, bananas. If you want to take B6, 300 milligrams daily is shown to decrease neuropathy and ototoxicity or toxicity of the nerve cells in your ear, which can happen with some chemotherapy. Lion's mane extract it's a mushroom, and as you can see from the picture, it actually looks like a lion's mane. And then preclinical mouse studies have shown it to repair nerves after injury. Human studies show that it increases cognitive ability, so it is neuro generating. We call it a nootropic. So it's smart drugs and cognitive enhancers is what that means. It improves cognition. It improves executive functioning, memory, creativity, or motivation. It is quite safe. They're mushrooms. If you're ever interested in knowing about mushrooms or the history, there is an amazing documentary on Netflix right now. Magic mushrooms, maybe. I don't think that's what I'll remember it just a little bit. Obviously, I need to take lion's mane to improve my executive function. Got it. It's Fantastic Fungi. It is an amazing documentary that just shows all the medicinal potential of mushrooms, including lion's mane. And then other therapies are contrast hand and foot baths. I recommend this for everyone anyway. These are just ways. Again, we're talking about bringing blood flow back to get those nutrients back to the nerves. So you want to start with, you want to do a little bit of friction and start with some warm hands and feet. You're going to do 3 minutes of hot water, not scalding, just hot, just enough to get the blood flow to the periphery. And then you're going to take your hands and feet, put them in cold water that says 30 minutes. That is not correct. That should be 30 seconds cold. And then you would not want to keep your hand in cold water for 30 minutes. So 30 seconds. And then you repeat that 3 times. And of course, you're going to bring the blood flow in with the warm water. You're going to shunt the blood flow away with cold water. And so basically, you're acting like a pump to bring that blood flow back and forth. Melatonin, I'm sure some of you have tried this for sleep support. Low dose melatonin can be used for sleep support. It's great, but melatonin is also very immune stimulating. So at higher doses and at 20 milligrams, there is it has been suggested there's a reduction in neuropathy. That was a very small study. So we would need to really study this a little bit more, but it can also lessen and prevent ototoxicity, or that toxicity of the ear nerves that some chemotherapy agents um, can have. It's also anti-tumor, so it has been shown to inhibit tumor growth, and that would be 20 milligrams nightly. The side effect of this is vivid dreaming. Sometimes that includes bad dreams, sometimes it doesn't, but it's just something put out there. Also, it can cause daytime drowsiness if you don't allow yourself enough sleep. And then self-care techniques. A study of 450 patients self-reported all the following techniques to relieve their symptoms: warm baths, walking. So there's our hydrotherapy and our exercise, elevating the feet, rubbing cream on the feet, massage, meditation, and acupuncture. I feel like I just flew through that. So I apologize if I went too fast. I would love to hear anyone's questions or comments, and I will stop sharing the screen.
Sure. Anybody have any questions? Yeah.
Are there signs of regrowth for nerves that a person can look for? Is there a certain progression when the nerves are regenerating?
Mm-hmm. That's a great question. There are sometimes it can be so with neuropathy, either you can have no feeling, you can have pins and needles feeling, but usually it's a tingling increase or a reduction in pain.
And would that be the same whether it's chemotherapy induced or surgical or radiation, or does it differ depending on your cause?
That's also a great question. I would have to check on the surgery. I would have to verify that before I answered. But as far as radiation and chemotherapy, really they both just damage the nerves. There are other things that you can do. So yes, it would be the same. So it would be the same as decrease in pain or increase in the tingling, but not painful. And then there's also, which I thought was on here, but it was glutathione is another substance that can be used that is helpful after treatment. Glutathione is like our body's super detoxer. We produce it naturally, but adding liposomal glutathione has been shown to detox heavy metals, including platinum-based chemotherapy or any lingering, which can also improve the healing.
Thank you.
Thank you.
Yep. Got one. How long after chemotherapy, say you get a sensation in your fingers where you can't feel, like how long does that take to go away? Is it a year, 2 years, 6 months?
Yeah. So I'll answer for the average, but as you know, there's outliers on both. I've had people who have had some neuropathy that resolves as soon as therapy is over, or if their dose is reduced, it resolves. I've had other people who it takes 6 months usually for it to resolve. And it depends on how much they're willing to do. Some people just don't want to do supplements, and that's fine. That's their choice. or they don't want to exercise, and that's fine too. But usually that speeds it up a little more. So I would say average 6 months, but I have seen it up to a year and a half.
Okay. Yeah.
Sure, going once, going twice. Well, thank you so much for joining us today. We really appreciated you joining us, and I think we all learned a lot. So thank you.
Thank you again for having me. If we do offer, if anyone is interested in naturopathic care, we do offer naturopathic visits, and also we offer acupuncture at the retreat for women. It's just not for women though. Men can come too. But if anyone's ever interested in that, we'd be glad to have you. So thank you, and congratulations on survivorship.